Hi folks, Darren O'Cafo, Manager of Learning Programs here at the Community Sector Council. Thanks very much for joining us today. Really excited about this webinar series. Before we start, a big thanks to Nick Mombourquette for agreeing to do this. These are going to be particularly useful, I think, given the current crisis, and it's always nice to have a good partner in play like Nick, but in particular right now, this is going to be a very topical talk. So. Essentially, the webinars were a joint collaboration between the Community Sector Council and the speakers, trying to come up with a way to address some of the shortfalls in the dialogue. And when we talked about this as a team at Community Sector Council, we thought that the idea of sustaining capacity was an interesting way of couching some of this. Normally, our job is to build capacity, but in a crisis, what we're trying to do is just hold some ground, hold some space, and make sure people are happy enough and able enough to do their jobs. And when we talked about it a bit more, we started to realize that one of the problems with working in the nonprofit sector is that because we're so values driven, we have this clash of need between pushing our organization's mission along and managing the basic day-to-day of being in a crisis. How do I take care of my family? How do I take care of my own mental health, my own self? How do I take care of my own profession? And so we wanted to offer something slightly different in the current dialogue. There's lots of capacity building stuff. How do you evolve? How do you innovate? We wanted to just see, how do we just hold some space? How do we maintain some capacity rather than lose some capacity? So we approached a couple of people and they all agreed to do these wonderful talks. So today we're going to have a talk from Nick, and it's what do I do with my benefits program during COVID-19? So Nick's going to help you better understand employee benefits provisions as they pertain to layoffs, what should be communicated to employees, premium deferrals, and when to contact your insurance advisor for help. Nick's bio is probably undersells him. He's a fantastic professional and a fantastic asset in the sector, but his bio is, whether it's employee well-being or personal financial security, Nick helps people protect things that matter to them. It could be creating a tailored benefits plan to support people who work tirelessly in the nonprofit sector, finding a sustainable benefit solution that supports a business owner's bottom line, helping a family protect their financial future, or introducing someone to new innovative ways of investing, or anything in between. And so for me, as a somewhat veteran in the sector, that sounds like a perfect match for what we're trying to do here today. So thanks very much, Nick. I'd like to welcome Nick, and we'll get started with the presentation. Just before we start, really quickly, one last thing. Any questions you have during the session, on the right-hand side or on your web panel or on the tool panel there's a bar that says questions. At any point during the session, if you want to ask a question, feel free to type it in the text box there. What we'll do is we'll gather the questions throughout the session. We'll give Nick a chance to do his presentation, and then at the end of the session, when we wrap it up, we'll have a 10-15 minute period for a Q&A. So at any point during the session, if there's something you'd like Nick to expand upon or to ask a more pointed question, feel free to type it in there, and we'll address that as the session finishes up. All right, over to you, Nick.
Perfect. Thank you all for joining in this morning. I'm pretty grateful. Oops, I'm grateful for our time here today. I'm just trying to hide something there quickly. Awesome. Yeah, so thank you very much. So yes, I am Nick Mombourquette, and I'm very grateful to be here today and share some information as employee benefits pertain to this COVID crisis and things that employers should be thinking about, in particular the nonprofit and social enterprise sectors. These are sectors that I spend a lot of time helping and have built literally a business around helping this sector. So I'm quite grateful to be here today and share any bit of knowledge I have as this fluid issue carries on. So I'll flip to my next slide. The first one here is my little son. I put this here. His name is Parker. He's just about 4 years old. He's got a Toronto Maple Leaf shirt on, which isn't my favorite team, but I thought I'd break up or start the presentation with a little laugh from Parker. And in the slight event that he might break into my office this morning, you'll know what all the ruckus is about. So that's him. So yes, as I mentioned, I own and run Newground Financial. I'm a certified employee benefit specialist, and we create tailored employee benefit plans for the nonprofit and social enterprise organizations. My intentions today are to give basically a 30,000-foot view on things that CEOs and/or executive directors should be thinking about as this crisis carries on, as it pertains to employee benefits. There's a number of different changes that have happened to employee benefit contracts since this crisis has started, and it's important, I think, to inform everyone of what those are and the questions that you should be asking yourself as you carry through. My intentions are to keep this about 15 to 20 minutes and have lots of questions afterwards if they are there. So step one, I've outlined what I think it's very important at this time, if you haven't heard from your benefits advisor, to definitely reach out. I'm sure you've already done that given how far we are into this issue, but it is very important to speak with your benefits advisor and find out more information about what's going on. I think we're going to cover a lot of those subjects here today. Also an HR professional and/or employment lawyer. Many things can come up as we're promising benefits or discussing benefits with employees during layoffs and those employee-related decisions that come up during a time of crisis like this. So prior to making any quick decisions, I highly recommend that you speak with your benefits advisor, an HR professional, or employment lawyer, ultimately before making any promises of benefits to your employees without fully understanding and knowing the contracts that you have in force. Number two, this area is one that has just come up. So typically, if you have a group benefits program and in a month you're in an unfortunate situation where you can't pay for your benefit program, the insurance carrier will typically give you 30 days to pay for that before they suspend your benefits, meaning employees aren't able to claim on it any longer, and or terminate your program altogether. During this issue, many of the major insurance carriers have extended that period now to 60 days. So for example, if you weren't able to pay your premiums on April 1st due to financial difficulties, then effectively you would have 2 months to pay those outstanding premiums while benefits are still in force for your employees. This is important to keep in mind, to know that that feature is there in the event that your organization is running into financial difficulties and you can't carry on your benefits or don't think you can. Fortunately, there is a bit of relief there to hopefully relaunch benefits programs and payments when we're on the other side of this thing. So keep in mind 30 to 60 days is the grace period. If you're unable to pay premiums, again, you would need to check with your specific insurance carrier to confirm how that may or may not apply to your specific plan. Number three, this is understanding the details around temporary layoff with disability coverage. So if we're fortunate enough to have a benefits program in the nonprofit or social enterprise sector, you may or may not have disability insurance coverage for your employees. And one main thing to keep in mind is if you do have disability insurance and you are laying off employees, is to speak with, again, your benefits advisor or insurance provider to see if disability benefits are being allowed to be carried on in the event of a layoff. So oftentimes you can carry on some portions of your benefits during a layoff, if it's maternity leave or paternity leave or something to that nature. However, disability benefits, depending on the wording of your contract, may or may not be able to be carried on. So it's very important to ensure that you know that upfront before offering it to an employee and saying, yes, benefits will be carried on during your layoff, because there are some circumstances in which a disability program may not be able to be carried on during that layoff. In the event that your disability program is allowed to be carried on during a layoff, there is a time period set in most insurance contracts, and from what I've seen so far, it's about 3 months. So for example, if I was laid off in April, again, I have 3 months potentially of disability coverage, after which time the disability coverage may cease. Now, this is an ever-changing subject, and the insurance carriers are reviewing these programs literally daily, so there could be a potential that that 3-month period could be extended. But as it stands right now, generally what I'm seeing from the major carriers, if disability is allowed to be carried forward, it's for a 3-month period of time. The other option here is understanding the details around temporary layoff without disability coverage. So in the event that you don't have disability insurance on your group benefits program, or that you do have disability insurance on your program, effectively all other benefits in most situations, it seems as though insurance carriers are allowing them to be extended for upwards of 6 months in the event of a layoff. So if you have a full plan, health, dental, life insurance, disability insurance. Some insurance carriers will cover disability for 3 months and all other benefits for a 6-month period of time. Again, you really need to ensure that you're checking with your contract and benefits advisor to confirm what those exact details are before, in my opinion, you're letting employees know that they would be extended coverage while they're on a layoff. I think it's important to know sort of the ins and outs as much as you can as you're providing this layoff and/or opportunities for your employees while they are laid off. One other piece that I will add, if you're extending full benefits with disability insurance, most insurance contracts or benefits contracts with disability are set up in a way that they become non-taxable in the event of a claim. So what this means is that if an employee had a $2,000 disability benefit and they were to claim on that benefit because of an accident or illness that prevented them from working, you would want to ensure that that stays tax-free to them. And the way that it does is that you're obtaining premiums from the employee on a constant basis. So if they were working full time, you would be deducting disability premiums from their paycheck. In the event that someone's laid off, you would want to set up some sort of arrangement, be it post-dated checks or something to that nature, where you're collecting disability premiums for that employee and sending it up to the insurance carriers on their behalf to ensure that that benefit becomes and stays tax-free in the event that they ever need to make a claim. Another area that I think is important to discuss and think about during this time is promoting your employee and family assistance program. Now, having dealt with many organizations in the nonprofit and call it social enterprise sectors, I see some organizations that have employee and family assistance programs and some that don't. So I'll explain briefly what they are. Effectively, it's a 1-800 line that operates here in Canada, in which employees and sometimes all of their family members, immediate family, are able to call basically a crisis line. So in the event that they have literally any issue, they can reach out and call. So it could be emotional well-being, family issues. You know, I'm stuck in the house with young children and it's been a month and a half. What do I do? Can someone help me through this and help me with some coping mechanisms? If I have legal trouble or marital troubles, financial troubles, these lines are really nice. They help you as the leader of your organization not have to answer all of these questions. And it's a wonderful resource for your employees to know that 24/7, you know, with a quick phone call, they can speak to an intake case manager who's typically a registered nurse and or medical doctor or a professional in whichever field aligns with their issue to guide them through. In the event, say it's mental well-being, these individuals would be offered counseling for a short period of time. So for acute issues, typically, you know, I see sometimes between 4 and 8 sessions to help them through whatever issue it is. In the event that it becomes something that needs to last longer or needs further treatment, then that professional on the phone would refer that individual to a local practitioner to take over and continue with their treatments. Sometimes these programs are embedded in employee benefits programs. If they're not, they can be added. So you can certainly speak to your advisor or insurance carrier and say, you know, how can we add this in? I think it's a small premium to pay for the value that it creates for our employees. Oftentimes I see a cost between, say, maybe $4 to $6 per employee per month for this type of program, and they can be set up relatively easy for employees to have access to and to use. Number 6, promoting virtual healthcare to your employees and adding it to your plan. Virtual healthcare is a relatively new coverage that is being offered in benefits programs, and by new I mean in the past couple of years. It works kind of like an employee and family assistance program, meaning everything is done non-face-to-face. So employees and managers and leaders of the organization would have the ability to meet with a medical practitioner over the phone or over Skype or like we're doing today for acute illnesses. So a cough, a cold, sinus infection, a rash, a medication refill. In the event that you can't physically see your physician or you don't have a physician to see, then virtual healthcare basically allows you to meet with a medical practitioner over the phone or over the internet to diagnose your acute issues and or prescribe a medication if required. An example of this would be, you know, say for example, I have a rash on my hand. I call the practitioner, I show them what it is. They say, okay, this is the medication you need. They write me a prescription, they send it to my pharmacy, and my pharmacy prescribes that, and then I can go pick it up. Given the fact that we're not necessarily supposed to be leaving the home, I think this is a great program to have on a benefits program. Some medical doctors, or most right now, are taking phone calls. The issue can be that some employees don't have a medical doctor, so walk-in clinics are very difficult to get to at this point, or if they do have a medical doctor, the lineups might be quite long and I may have to wait a few days. The benefit with virtual healthcare is it's 24/7. You're able to pull up the practitioner within a couple of minutes and be on your way. Step 7, is your plan scheduled to renew soon? A benefits program typically renews on an annual basis, not necessarily a calendar year, but on your anniversary of your policy, so whenever it's started. Most major insurance carriers at this point, if you have a benefits program that is set to renew in the next few months, and you may or may not know what that term is, but a renewal is when your broker would meet with you a couple of months ahead of time and say your plan has used this much in the past year and you've paid this much, and therefore this is what you need to pay on the year coming forward, much like a renewal on your home or auto insurance. The insurance carriers are pushing these ahead 1 to 2 months given the situation. So if you haven't been contacted by your insurance advisor, you can definitely reach out and see what the implications would be to your program and how you can better prepare for an upcoming renewal in the next few months. Step 8, I've outlined controlling costs with plan design. So I've had some employers and my clients reaching out to me saying, listen, we have our benefits. We really want to keep it going as long as we can for our employees in light of some being laid off or just funding drying up or whatever. You know, some immediate ways in addition to what we've talked about so far could be changing your plan design. There are some very unique ways that you can change the design of your benefits offering without taking too much away from employees, but still allowing them to have a nice plan and controlling costs at the exact same time. One that jumps to mind is dental coverage. Oftentimes, well, right now, for example, dental coverage, you're in case of an emergency, you can't really go see your dentist at this time. So there are some ways that you can mold your dental coverage in the short term to allow, you know, for some premium savings for yourself and your employees while you may or may not be using that program. One is recall to see the dentist. So oftentimes we There may be, the ability in your benefits program to see your dentist maybe once or 2 or 3 times a year. That is the term called recall. Scaling that back to maybe once a year can often save between maybe 4 to 5% of your dental premium. And oftentimes, as long as you're getting your teeth clean, then the requirement to actually see the physician isn't necessarily 2 times a year. 1 time should suffice, and you're saving quite a bit on your dental premiums for yourself and everyone in your plan. Further to that, there have been some recent changes, and as recent as Friday, yesterday, today, many of the insurance carriers are taking it upon themselves to find ways to help you save premiums on your benefits programs as well. So these are some general stats from some of the major insurance carriers. Again, your program may be participating in this or not, but it's worth reaching out and finding out more about. Effectively, what I've seen, from the major insurance carriers, that is about 50% credit towards dental premiums is being offered either for the month of April or May or both, and a 10 to 20% credit towards non-drug related health premiums. And some insurance carriers are doing 10% towards drug-related health premiums. This is pretty interesting. I think it's a great a move on the insurance carrier's part to ensure that employees are still being able to have benefits, that employers who may be cash-strapped in these times are able to carry those on without much financial worry. And I think it's an investment in their part, and a very significant investment in benefits to ensure that they can carry on. It effectively, in most cases, you as the employer don't need to make any changes. This is happening automatically. In some cases, you do have the option. One carrier in particular is allowing you to either take one of these options or pick it up, the savings on your renewal. So again, the importance of speaking with your insurance company and or insurance broker about these options, I think is worth your time. So that's really it. I wanted to get through that as quickly as I can and get a very high level overview of some of the rapid options that are being introduced and changing with regards to benefits during this time. I know we have some time for questions now, and hopefully there are some, and if not, that's great. Thank you so much for your time. I really appreciate it, and I'll stand by for questions.
Thanks so much, Nick. That was super informative, really packed full of useful information. I think a couple of quick questions, if you wouldn't mind, and feel free to kind of dance around them or address them how you feel is useful. But I'll just kind of go through a couple fairly quickly, and then we kind of have a bit of a chat if need be. Excuse me. There is a question around if you're in mid-treatment for something, and this has unfolded and your treatment's being covered by your benefits, how does a shift in your employment status, how is that reflected, or how does it impact something that's kind of currently mid-treatment, particularly if you really have no choice to advocate on your behalf, or there's no real option for your employer to look at alternatives? Is there a scenario where the insurance broker or the insurance company is still liable or still responsible, or is it more of a kind of a vacant landscape in that sense?
Yeah, that's interesting, and I'll guess that maybe this is either a dental procedure or something like a massage treatment or chiropractic treatments and or possibly psychological. It generally contract wording around benefits, and again, every situation is different, so you definitely have to review your wording, but employers do have the ability to modify benefits plans as they need to. So in the event, for example, if someone was receiving a treatment and the benefits program needed to be scaled back, or someone was laid off and benefits weren't continued, then that's, I guess that's kind of, there's not much you could do. In the event that someone is, and again, just trying to do hypothetical because I don't know the exact details of the question. In the event that someone is laid off and maybe loses benefits and had been part of a treatment, there are some individual health insurance options that folks can pick up and could arguably carry on some of those treatments, but under a different plan. That plan they may have to finance themselves, but those options are available. So, and if you do have questions about those or weren't made aware of them, you can definitely email us and we'll point you in the right direction.
Perfect. Second question would be, could you give us a bit of a kind of an overview on how you should approach your benefits provider or service provider? Should it be from an advocacy perspective? Should it be from an information perspective? Is there room to advocate with on behalf of your staff right now? And I guess the follow-up question or the related question is, has there been a kind of an emergent flexibility demonstrated in the insurance industry? I think you referred to it a few times that there has been kind of an attempt to shift and pivot. But do we have the scope to kind of approach providers as from more of an advocacy perspective rather than an information perspective?
Right. Yes, I would say so. Your voice should always be heard. Me in particular, if my clients approach me with ideas, my intent is always to bring it to the insurance carriers as much as I can. So I think it's the communication to your advisor to express what your scenarios are. Now, unfortunately, we're typically not the insurance company, but I think if we're doing our job, I consider my job is advocating for my clients. I believe I don't represent the insurance carriers, I represent you. So I would hope that all brokers are doing the same. And up until this point, and I can only speak for myself, when I've received inquiries from many clients throughout this period, I've been quick to relay those to the call it the higher ups, in some cases the ivory towers of the insurance carriers, to let them know. And I will tell you that many of these changes that I've mentioned today in this presentation have been because of that. Now, not necessarily because of me, but because of advisors who have that designation that I outlined in the beginning, the Certified Employee Benefits Specialist. This is our gig. This is what we really care about. We do collectively work together with our colleagues throughout the country and advocate with to the insurance carriers and to an organization called the CHLIA, Canadian Life Insurance Association, and they are helping guide the major insurance carriers through this. So collectively, if you see one major insurance carrier do something and then the other, they are working together to ensure that there's some sort of, a combined effort to help everyone across the board with these advocacy groups as well. So, I would say don't be scared to voice your concerns and ask anything you can. And it might sound outlandish, but who knows what the insurance carriers are working on and how they're going to try and help you carry your benefits on a go-forward basis.
All right. The next question is about, is there a shift in employer responsibility in regards to health? Our employers, has their set of obligations and responsibilities around employee health changed? And if so, how does that impact benefits packages that are kind of already in place in midstream? Maybe you don't have any info on that, but I'll throw the question out.
Yeah, no, I think that's a very, very interesting question. I believe it has. I believe that what I've seen from clients is that they're doing that already. They're implementing benefit programs. The old way effectively was to say, how can we attract and retain good people, which I think is still a good reason to have a benefits program. But now it is, how can we attract and retain and help our people stay healthy? And what are those benefits that we can offer to do that? So I can't speak to the legalities of it and or effectively the HR, but what I can say from the insurance carrier side, I've seen so many I guess new innovative ways to offer benefits and make things easier for employees to make claims and get the help that they need, that I think effectively as an employer, I believe in my opinion, it should be your responsibility to be well educated on these programs and ensure that they're being offered, and reviewed with your employees. And one other thing that I didn't mention today, but would be of use maybe to some employees during a layoff or not, is if benefits are being extended, maybe your broker would be willing to host a webinar like we're doing today for your employees to remind them of the coverages that they have. And I think this would be a great due diligence and a great offering to employees to say, hey, listen, we've extended benefits, we care about you, and here's how you can use your program during this time. I've got so many emails over the past few weeks that I can't get through them all from everywhere. And wouldn't, maybe as an employee, wouldn't it be nice to sit and be able to review my program and know how to use virtual healthcare, or know that the employee and family assistance program is there. So,
That's fantastic.
Yeah.
So that's a great idea. So you should feel empowered as an employer to approach your benefits provider and suggest, could you come online for a 15-minute webinar and just kind of help run through what the package looks like and what some of the emergent kind of realities have done to this package, and maybe just give us a bit of an overview as to where we sit currently in relation to the particular package that we have. So absolutely approach your provider and engage them in a conversation, and maybe seek out that kind of interaction from them.
Absolutely.
Two more questions. When the pandemic conditions are eased, are premiums likely to ease or get more expensive, i.e. if renewal is on the horizon 3 to 6 months from now? And so many employers will continue to struggle with costs. Any kind of comment you could give in terms of your sense of what the industry, where that kind of sentiment is headed, or if there has been any kind of sentiment in that regard?
Right. That's a great question, and I think it can be answered in a few parts. And one is, to consider this premium reduction and its effect on the programs. So I think immediately it's great for those who are cash strapped as organizations. But I do think there's, you want to evaluate it and go, okay, there's a term that I use often that says today's claims are tomorrow's premiums. So keeping this in mind as you evaluate any sort of cost saving features that are available to you today and how that may impact your renewal is I think quite important. One thing that's been on my mind is thinking, okay, right now many employers and their employees can't see the dentist, and this is typically represents about 30% of total claims on our group benefits program. So what, for example, let's say we're all back to normal in July or June or whatever that date is, my assumption is that many people will be going to the dentist, and I presume dental offices will be working as close to 24/7 as they can to reuptake that. So, if there are decreases in usage today, I can only assume they'd be picked up at some other point to either level off the way they would have in a typical 12-month period, or maybe even a spike. So that's something to keep in mind. And I think the other side of it is, I unfortunately, with the incidence of COVID, I do believe disability claims are probably on the rise to some degree. They have been outside of this anyway, especially in the nonprofit sector. You're one of the highest disability claim instances anyways. So I do predict disability premiums going up over time, as they have. And I think this situation is probably not helping that. So I do believe this is a very interesting time to ensure that you're dissecting the plan that you have to as much detail as you can, and I hope that your advisors are reaching out to you and discussing this to some degree, and really taking a deep dive, prior to your renewal, to look at those options. And some of these options that I've seen, and Darren, if I can take a minute, to think about that is, introducing health spending accounts to group programs. So a health spending account is basically like a dollar set figure for employees to use whichever way they need to cover off medical expenses. Some employers are now removing dental, for example, and replacing it with a health spending account to control costs and give more flexibility to employees. Changing the recalls, as I had talked about, looking at methods to decrease claims for drug usage. So for example, if I have a medication and I go to one pharmacy versus the other, we could be paying a lot more depending on which one we go to. So some programs and some insurance carriers are saying, why don't we offer home delivery of medications? we'll go to a set provider who will give us a very low rate to dispense that medication. And overall and over time, this will decrease the cost to our benefits program. So there's a number of different mechanisms that are out there that you can tweak your program and plan for employees without creating a major change, but also decreasing costs today and stabilizing them for the future. So I think that this COVID issue has brought to light something that I've been preaching to many clients and prospects for a number of years, and that's really digging down to say, you know, the traditional type plan might not be what you need to have going forward, and you might need to review your whole plan together and find out what's going to be most cost effective for yourself and your employees, but still giving them amazing benefits.
Right, that's a fantastic point. So the burden of innovation isn't just on the providers. It's up to us as well to join that conversation and to see the ways in which, or to kind of innovate around the ways in which we can all share this kind of emerging burden.
Absolutely.
Okay, the next question is, are you aware of pharmacists changing the dispensing fee rules? Instead of providing 3 months prescriptions at one time, I've heard that some are now only allowing 1 month at a time, so you end up paying 3 dispensing fees instead of 1.
Yeah, that's been certainly in the media quite a bit. I don't think there's a set I know for sure there's not a set dispensing fee across the board. I really think it depends on which provider you're going to or which pharmacist. Prior to the crisis, it would be the same. If you went to X, like I discussed, the dispensing fee, you could be paying $12 at one, where you could be paying $4.50 at another pharmacy. And that regulation, I don't think, from my perspective, it doesn't seem too tight. So you literally could pay a different price for the same medication at multiple pharmacies. So this is something I've preached for a long time, and it's sort of buyer beware. You might need to shop your pharmacy at this point. And for those maintenance type medications that you're referring to, ones that you would typically get a 3-month period and now they're only giving you 30 days or vice versa, I think it's important to reach out ahead of time and see what that may look like. Obviously, it would be cheaper for one to obtain a 3-month prescription than it would to have it dispensed 3 times and pay, you know, $12 each time, for example, or even $4.50 each time. You know, it's important to consider that. You know, generally why pharmacists and even plans themselves, benefit programs, you know, if you're on a new medication, usually there's only a 30-day supply because the physician and or the benefits providing company wants to ensure that that medication will be the one for you. If I had a new medication and it was dispensed for 3 months and I only used it for a week and it didn't help my arthritis, for example, now I have 3 months worth of prescription that I need to throw in the garbage, and it's been a waste. That's why that mechanism had been there, but obviously now it's a little different, and I think it's, you know, my recommendation would be it's important to shop around to your pharmacies. I don't have any particular one, nor am I sponsored by anyone, but I do know, for example, that the Costco pharmacy seems to be the cheapest. You don't need to be a member to get your prescription there as well. So if you're not a member, you can do that. So that's something to keep in mind if you're looking to decrease the cost of your dispensing fee.
This is the fantastic answer. And one of the interesting kind of side notes about this current reality is that this seems to be an amazing opportunity for employers and employees to build up a set of, or a level of functional literacy around some of these services that are kind of peripheral to their day-to-day work. So benefits are often these things that people don't tend to notice until they need to reach for it. And even then, it's kind of reach for what works and then get it out of the way. But it seems like this is an ideal moment for people to stop and actually pay attention to what services are open to them and what the details and nuances of those services are and whether they're actually right at the end of the day. And so, you know, one of the oddities, I suppose, of this reality is that it's provided us with a potentially interesting avenue to build our literacy around some of these things.
Absolutely. Yeah, I think it's well worth your time to take a peek if you're fortunate enough to have a benefits plan to really dig into it and find out what's working and what's not. And ultimately, I would recommend as part of the advocacy question, is, you know, sit down and design what you think would be an amazing plan, and then go out and say, who can do this? And is it possible? maybe it is, maybe it isn't, but there's lots of new innovative options that are being offered throughout benefit programs. And I really do, Derek. I think it's a great time, if you're fortunate enough to have some time to analyze that and ensure, are we offering the best, most cost-effective benefits program for our employees today and in the future?
Right. So yeah, it falls to us to be informed consumers about all of the things we consume, but very much in this case, it falls to us to be active and informed consumers around these kinds of products.
Absolutely.
The last question. Thanks, Nick. The last question is a two-parter, and I'll just run through it real quickly. For those employers on a health spend account in the nonprofit sector, what, in your experience, is the annual benefit amount, i.e. is it $200 per year? And then the follow-up component of that is, and is it typically the same across the board, or is it based on employee earnings per year?
Sorry, I'm just writing that down just so I have it.
Yeah, I can go back over it if you like. Would you like me to?
I would say, so for part one, it varies. So a health spending account, I see it offered in two different ways. So one, an organization may have a traditional benefits program and then couple a health spending account on top of it. So in that situation, that health spending account might be a little less than the organization that only has a health spending account as its offering. So it's certainly relative to every situation. 250, I would say I'd probably see closer to 500 to maybe 1,500 a year, depending on that said, whatever the organization is. Sometimes these organizations may even have different classes for their health spending account. For example, executives and management might have a little more than part-timers if it was offered to part-timers, or to seasonal staff, or to just regular employees outside of the management spectrum. So most insurance carriers will want a minimum sometimes of around $1,000 per employee or $1,500, but that is quite flexible. We're fortunate enough to have partnerships with some that really you can choose whatever you want, which I think is great. As far as sorry, part two. Can you reiterate part two, Darren?
Yeah, sure. Is it typically the same across the board, or is it based on employer earnings per year? And a qualifier, the person who posed the question qualified that 200 should have been 2,000. So there was a lack of clarity on my part there. But yeah, the second part is it typically the same across the board or based on employees' earnings per year?
Right. So, again, I guess back to part one, it can be different relative to, I guess employee earnings might dictate that. It could usually be employee class in the organization and class it out via earnings or via position, but usually those are kind of in lockstep to each other. On average, we see about and recommend like maybe 10 to 15% sometimes of a salary could be something to keep in mind. But again, it's relative to every organization and it's relative to budget. But I think what's interesting with the health spend is that, it is so flexible in most cases that you can really choose what you want. So, for example, if an organization that may or may not have one and is looking to introduce one, you can really go, what do we want to spend per year on our benefits for employees or per employee, and you set the figure, that fits your budget. But, again, probably back to 1,000 to 2,500. I've seen some as up to $5,000 a year. It's certainly relative to budget and what you want it to do for you. But the health spends can be tailored in such a way that they're quite flexible, and for the most part, I've had pretty good feedback from the employees who are taking part in those.
That's fantastic. So we've reached the end of the webinar. I just want to give just a thorough thank you to Nick Mombourquette and the folks at Newground Financial. Really, really appreciate this, Nick. It was so informative, and I think it helps ease the burden for people, try to make some sense of what often is an area or a landscape that they're not overly familiar or not overly comfortable. Some of this financial stuff can get technical quickly, and I think it puts people ill at ease often. So having someone like yourself sit in the middle and speak, translate for us from the technical, financial speak down into regular human speak, really makes carrying this burden a lot easier. So our utmost thanks from the Community Sector Council and on behalf of the sector too, Nick. We really appreciate the talk. And we're going to look forward to having you back as soon as we can to do another one.
Absolutely, it's my pleasure. And again, my disclaimer there, this is for educational purposes only. So I highly recommend you speak with your advisor. Hopefully you learned something today. I thank you all for your time, and I'd be grateful to come back and do this again at some other point.
That's great. And thanks everybody for attending. The numbers have been fantastic. If there's any questions or if you have any concerns or queries, feel free to send them along to me. And if you want to ask Nick another question, feel free to send me a question and I can forward it on to Nick for you. So appreciate you taking part in the webinar. We have another couple scheduled throughout the week. If you haven't seen them already, feel free to take a look at our website and go through what might be interesting and might be pertinent to you. Everybody stay safe, stay healthy. Best of luck out there. Keep it together. We'll make it through this thing. All right, take care.